Welcome to Western New York and the Buffalo Niagara region. Thank you for exploring the University at Buffalo Anesthesiology Program. I'm Dr. Mark Lima, SUNY Distinguished Professor and Chair of Anesthesiology at the Jacobs School of Medicine and Biomedical Sciences here at the University at Buffalo. I also serve as Professor of Anesthesiology and Oncology and Chair of Anesthesiology, Critical Care, Pain Medicine, and Perioperative Care at the Roswell Park Comprehensive Cancer Center. We are very proud of our history as one of the oldest anesthesiology programs in the nation, dating back to the 1920s, when Dr. John Henry Evans became the first professor of anesthetics at the University of Buffalo School of Medicine. In the 1950s, Dr. James Elam at Roswell Park Memorial Institute developed the soda lime absorber, which scavenges CO2 from expired breaths of ventilated patients, preventing them from becoming too acidotic during surgery. He also developed the mechanical ventilator, which is still in active practice today throughout the entire world. Finally, he is the father of mouth-to-mouth resuscitation, which is widely used throughout the world during codes. We are a very prestigious institution, and we boast 2 past presidents of the American Society of Anesthesiologists, 2 past honorary treasurers of the World Federation of Societies of Anesthesiologists, and 2 SUNY Distinguished Level Professors, which is the highest professorial rank given in the SUNY system. Our alumni are practicing in the US, Canada, and all around the world as far away as Guam. UB anesthesiology is somewhat unusual as there is no single university hospital. Instead, we are able to offer our residents an indispensable experience at our 6 separate clinical training sites where specialized anesthetic cases are routinely being performed. This broad spectrum opportunity to experience such a clinical variety naturally exposes our residents to a vast array of different anesthetic techniques taught by our diverse faculty. Moreover, it allows residents to practice special anesthetic techniques pertaining to the care of cancer, cardiac, trauma, neurosurgical, obstetrical, and pediatric patients. Our program is committed to excellence in resident education, clinical care, as well as research. The extensive and in-depth training prepares each of our residents to successfully pursue their goals, whether it be in teaching, clinical practice, or research. We are aiming to train the enthusiastic physicians who seek the adventure of an innovative, educational, and unyielding clinical experience, as well as an extensive range of investigational opportunities through our prestigious NIH T32 research program. We would like you to become part of it all and to become one of us. Best of luck with your interviews. Thank you and have a good day.
Hello, my name is Stacy Watt, and I'm the Anesthesiology Residency Program Director here at the University of Buffalo. Our faculty, fellow, and residents are going to take you on a mini tour of the operating rooms at each clinical site and tell you a little bit about what educational opportunities await you. We've made a lot of changes over the past number of years to our clinical program. Not only have we expanded the opportunities available to our residents, but we've added new programs that not only enhance the education you'll receive here at the University of Buffalo, but make it an educational opportunity second to none. In addition to Lean Six Sigma training, you'll also have the opportunity to work with our basic science research team. On that team are T32 grant recipients who work with NIH-funded research right here in the University of Buffalo. We also have a special program here at the University of Buffalo that I'm rather proud of, and that would be our house training model. As you enter our program as a PGY1 resident, you'll be placed into one of our 4 houses. You'll not only have the opportunity to be part of a team within a team, but you'll also have the opportunity to go ahead and be a part of the community of Western New York. We encourage each house to participate in a community involvement activity at least once per year. Some of our house initiatives have included fun events such as painting rocks to share with the children of Western New York, but also done serious training, such as Stop the Bleed, where our residents have not only participated in training, but are now also certified as trainers in the Stop the Bleed national program. In addition to all these educational opportunities that await you here in Buffalo, we also have 2 new opportunities that we've recently come across. Those 2 new opportunities have to do with wellness. Not only have we brought forth a yoga instructor to teach you a little bit about balance, physically and mentally, we've also brought in a health and strength trainer who will teach you a little bit about nutrition as well as strength training. The goals of these opportunities are to help you maintain balance not only within your residency training program, but also throughout your life. Without further ado, let's go talk to our chief residents who are waiting for you in the simulation lab to tell you even more about our program.
Hi, we'd like to officially welcome you to Buffalo, New York. We're the Chief Anesthesiology Residents here at the University at Buffalo. My name is Christopher Obua.
I'm Noah Yang.
And I'm Sam Tillmans. We'd like to welcome you guys here today to the University at Buffalo Jacobs School of Medicine. We're currently in the Simulation Center. This is a great place that you guys will really enjoy. You'll come here to learn many different skills that you'll use in the operating room. This is a great place. You'll be practicing lots of IV placements, arterial line placements, doing epidurals, endotracheal intubations. Just a really great place to practice your skill set before moving on to the hospital. Going through here will really help to prep you before you graduate so that you can successfully succeed as an attending on your own.
One big advantage of this program is that our residents go to quite a few different hospitals for rotation, and each hospital gives you a unique clinical experience. At Buffalo General Medical Center, you get to treat very sick patients and get very comfortable doing complicated cardiac, vascular, and neurosurgery cases. Erie County Medical Center is a level 1 trauma center in this area where you get exposed to all kinds of trauma cases all year round. You also get to treat trauma patients at the Oshai Women and Children's Hospital, where you will also treat neonatal, pediatric, and high-risk OB patients. At the VA, we have the privilege to serve our veterans. Roosevelt Park Cancer Institute is the cancer center in Buffalo, where you get to see a wide variety of cancer pathologies and treat cancer patients. This unique experience will also make you well prepared to work at any hospital you decide to go in the future, because you get used to new EMRs and staff members really quickly.
Outside of the medical school and the hospitals, Buffalo is an up-and-coming city. We have areas like Canal Side where you can go in the summer and watch wonderful concerts. We have excellent biking and running trails around the city and wonderful green spaces. We're also close to Niagara Falls, which is a world-class destination for people to come and travel to. We also have an excellent brewery and restaurant scene here. In the summers, we have Food Truck Tuesdays, where all the food trucks congregate, where we can listen to music and have excellent food. Because as everyone knows, once they get here, we're known for a lot more than just our chicken wings.
Hi, I'm Cyrus Tanhai, one of the pediatric anesthesiologists at Oshai Children's Hospital. I actually been in attending for 2 years now, did the pediatric fellowship here, and I did the residency program here too before that. And that's actually one of the things I love about the residency program here is we have basically all of the fellowships here. I also, believe it or not, I do love the weather. I was raised in Memphis, Tennessee, and just the heat, humidity, the weather in Buffalo, we get all 4 seasons. The winter's definitely not as bad as you've heard. But the residency program, other great things that we have, multiple sites. It's not just one site where you go in and you're just stuck there in the big university hospital. We have one of everything. We have a level 1 trauma center. We have a VA hospital where you have that demographic, a dedicated women and children's hospital, a suburban hospital. We have it all. Just all the great things about our program here, and we're looking forward to having you here.
I'm Dr. Alex Levine, one of the CA3s here at University of Buffalo. I'm from Louisville, Kentucky originally, and I chose the University of Buffalo because of the fantastic faculty members here. Any site you go to is going to be filled with faculty willing to teach you to be the great next anesthesiologist. 2 of those wonderful faculty are here right in the room, waiting to talk to you.
Hi, I'm Dr. Rutkowski, one of the cardiac anesthesiologists here at Buffalo Medical Center, and it's our privilege to introduce you to the Gates Vascular Institute and talk to you about our experiences here. And this is Darcy Miller.
Hi, I'm Dr. Darcy Miller. I'm also an anesthesiologist who works at Buffalo General Hospital and Gates Vascular Institute, which form Buffalo General Medical Center. We work for Buffalo Niagara Anesthesia, which is a private practice group that works at both of these hospitals, which are combined under the medical center umbrella.
So I'm one of the associate directors of the cardiac fellowship program, but I also work closely with the residency. And here we are actually in the cardiac room, and behind me you can see the echo machine and the general setup for the cardiac procedure. You'll spend all your advanced rotations, some of your most advanced procedures here in the Gates Vascular Institute, including neurovascular, major vascular cases. Upstairs in the Gates Vascular Institute, we have our structural heart program, and we work with some of the top proceduralists and surgeons in the country. We have very high volume, and we do very interesting and innovative cases. This building, we also do our major neuros cases as well as major vascular cases.
Across the land bridge, just a very short walk away, is the Buffalo General Hospital side of the medical center. Over there, we have another set of operating rooms that are mainly orthopedic surgery. You're also going to get plenty of general anesthesia, general operating room cases, and you're also going to see a lot of your larger spine cases occur over there. We do a large amount of neurospine cases, and you'll get a very good experience in that. One of the things that's a major benefit to this program is that you will be completely ready for anything. The nice thing about coming to Buffalo General Medical Center is that you will see the entire amalgam of cases you could possibly want to see. We have very high acuity population here. We have a large catch-all where we're going to pick up the northern part of Pennsylvania all the way up to Canada, and we do get the sickest patients in this area. So you're going to see high acuity. You're going to be prepared for anywhere you go and anywhere you're going to work.
I would also add that on top of your academic exposure, you're going to get very high volume private practice exposure, so you definitely get the combination of the two. So wherever you go, wherever you end up, you're going to be prepared for both.
Just so that you know, the Buffalo General Medical Center under Kaleida Health was recently named to be one of the top hospitals in New York State by US News and World Report. They're #1 in the Buffalo metro area. They're also 16th in New York State, one of only 30 hospitals to be named so out of the entire state. So you're going to be here practicing with the highest level surgeons, with the highest level anesthesiologists in this area, and you're going to get an excellent training here.
I am not a native to Buffalo, but I came here about 5 years ago and I love it. I love everything about it, the people, the community, and even the weather, believe it or not. I love the 4 seasons here. There's tons to do, and yeah, welcome to Buffalo.
I agree. I have to say, while I grew up here, I left when I was 18 and I recently came back. I did not train here, I did not do medical school here, but I did come back, and I have to say, in comparing this program to where I trained and multiple other programs that I've seen, you do get an excellent training program here. And while I trained in Albany and came back down the road to Buffalo, I do have to say I enjoy teaching in this program quite a bit, and I really enjoy our residents and feel that we've got a very personable program where you can be on first name terms with any of your attendings, and we're happy to talk to you and happy to help teach anytime. And I really do hope you come to Buffalo and learn to enjoy the Buffalo area as much as we do.
My name is Dr. Anton Emmanuel Webb. I am from Columbus, Georgia, and I chose Buffalo because of the diverse opportunities and fellowships. Buffalo has fellowships in pediatrics, pain management, and cardiothoracics.
Hi, my name is Dr. Paul O'Connor, and I'm one of the CA2 residents here at the UB Anesthesiology Residency Program. And I chose the University of Buffalo for my residency training because the University of Buffalo offers a wide range of clinical experiences throughout all of our different rotation sites. Today we're at the VA hospital, which is unique because the VA offers us a wide variety of surgical and anesthesia techniques to learn. We are exposed to many different types of surgery and anesthesia here with patients that are often very critically ill, as we are a referral center for many smaller hospitals. Life in Buffalo is pretty great. We offer a wide variety of different activities to do, whether you like things in the summer, such as going to the beach close by, or more winter activities such as skiing and snowboarding. And here we have 2 of our great attendings, Dr. Hobaika and Dr. Hitt.
Hi, I'm Dr. Jeffrey Hobaika.
I'm one of the staff anesthesiologists, and we're coming to you from the VA Western New York healthcare system. A little bit about myself. I'm a clinical associate professor in the Department of Anesthesiology for the University of Buffalo. I'm also the residency site director for our Anesthesiology Residency Program at our medical center. In addition, I'm a proud U.S. Army Medical Corps veteran, and I participated in Operation Enduring Freedom and Operation Iraqi Freedom. I'm here with Dr. James Hitt today.
My name is Jim Hitt. I'm an assistant professor of anesthesiology at the university. I'm a staff anesthesiologist here, and I'm also a pain physician doing interventional pain procedures at the VA. After working here and being inspired by veterans like Dr. Hobaika and the patients we take care of, I'm also working on joining the Navy Reserves.
What is the VA hospital? Well, the primary mission of the VA hospital is to take the best compassionate care that we can of our nation's veterans. Another important mission of the Veterans Administration is to train the future physicians for tomorrow. The VA hospital system is composed of over 1,255 facilities nationwide. That includes 170 major medical centers of varying complexity, again, dispersed throughout the country by region.
And so the VA Western New York healthcare system is a great group of multiple disciplines. And the anesthesia department works very well with the surgery departments and the medical departments, taking care of oftentimes complex patients. And as a result, we've ranked 13th nationally for our clinical care, and we were recently awarded a 5-star rating for our clinical care. We have wonderful initiatives in robotic surgery, cardiac surgery, interventional cardiology, thoracic surgery, as well as PTSD treatments and integrative medicine. So all in all, the VA is a great place to work, and the teams function very well together to provide exceptional care for our veterans.
So what can we offer our anesthesiology residents and fellows when they come on rotation here at the VA hospital? We have a diverse array of types of surgical cases that we perform here, including a busy robotic surgical service and the surgical subspecialties of gynecology, urology, thoracic surgery, general surgery, and colorectal surgery, just to name a few.
And so in order to perform these interesting and complex cases, each OR is equipped with state-of-the-art Draeger anesthesia machines. Like you see here, we have quantitative train of 4 monitoring and EEG monitoring for carotid surgeries. Each room also has a video laryngoscope. We have digital bronchoscopes, as you see here, for both performing bronchoscopy as well as awake fiber optic intubations. We have 2 state-of-the-art Philips ultrasound machines that we use for ultrasound-guided blocks for regional anesthesia. And then we also have the Da Vinci robot that's at the center of our robotic surgery program.
We also take great pride and personal responsibility in helping our anesthesiology residents become the best future physicians that they can be. Our program has been in existence for decades and has a long established tradition of producing outstanding clinical anesthesiologists who, when they graduate from the residency program, are comfortable really going anywhere and doing anything. And I would put our graduates up to any graduate from any other program across the country. You'll be comfortable whether you want to go immediately into private practice or an academic setting or go on to fellowship. Again, my name is Dr. Jeffrey Hobaika.
I'm Dr. James Hitt.
And we really hope to see you next year.
My name is Travis Blanton. I am a CA1 here at the University of Buffalo. The thing I love the most about the University of Buffalo is our diverse set of clinical environments. So there's 6 different sites that we rotate at for clinical experiences.
Hi, my name is Dr. Zach Fetter, and I'm one of the CA2 residents here at University of Buffalo. And I was going to tell you why I chose Buffalo. First off, we get a chance to rotate at a bunch of different hospitals, which gives you a wide range of experiences that really preps you for being that future attending. On top of that, Buffalo is going through a huge resurgence. And there's tons of great things to do all around town. It's definitely a great place to train. So here I have Dr. Lehrman, one of the pediatric specialists here. He's here to talk to you a little bit more. So here we go. Hey, Dr. Lehrman.
Hello, my name is Gerald Lehrman. I'm one of the senior pediatric anesthesiologists at the John R. Oshai Children's Hospital here in Buffalo. This hospital is the site where our residents and fellows acquire all of their pediatric anesthesia and the majority of their obstetric clinical experience and education. Oshai Children's Hospital, formerly known as the Children's Hospital of Buffalo, was founded in 1892 to serve the children of Western New York and Southern Ontario. The hospital moved to its current location in May of 2018. This facility is a 185 inpatient bed hospital, including 64 beds in the neonatal intensive care unit and 20 beds in the pediatric intensive care unit. Being the only children's hospital in Western New York, we serve the entire pediatric population and provide much of the OB services in the Buffalo area and surroundings. As a combined women and children's hospital, we deliver 3,300 babies per year and provide anesthesia services for over 12,000 surgeries and procedures in infants and children. Our anesthesia staff includes 25 experienced and dedicated pediatric anesthesia, intensive care, cardiac, and obstetric trained anesthesiologists, with most of us trained in the United States and Canada. The residents in our program rotate through Children's Hospital in 2-month rotations, acquiring the basic skills in pediatric and obstetric anesthesia under the direct supervision of our staff with one-to-one teaching in the operating room. Residents acquire the skills to manage children with common illnesses and congenital defects, to manage the pediatric airway, learn to establish vascular access, understand the unique aspects of pharmacology of drugs in neonates, infants, and children, as well as learn regional anesthesia. In OB training, our residents learn how to evaluate and manage laboring patients with a variety of complex medical conditions for peripartum analgesia, including epidural placement, combined spinal epidural techniques, and the range of anesthesia techniques for C-sections. In addition to the OR teaching, we hold weekly academic seminars for our trainees at Children's, covering a range of basic topics for pediatric and obstetric anesthesia, as well as monthly morbidity and mortality rounds. Our fellowship program is 1 year long, and it's based solely at Children's Hospital in both pediatric and obstetric anesthesia. Our pediatric anesthesia fellows develop advanced skills in anesthesia with more responsibility to plan and manage the anesthetic for a range of complex surgeries, including congenital defects in neonates, airway surgery, neurosurgery, craniofacial and plastic surgery, and spine surgery. Experience in advanced airway management, including fiber optic intubation and video laryngoscopy, is also available. Pediatric anesthesia fellows can also schedule a 1-month rotation in pediatric cardiac anesthesia at Strong Hospital in the University of Rochester in Rochester, New York, as well as 1 month in the neonatal or pediatric intensive care unit at the Children's Hospital here in Buffalo. Our fellows in OB anesthesia manage high-risk OB cases and consults, including managing the difficult OB airway and ultrasound-guided neuroascial blocks. All of our fellows develop skills in presenting rounds weekly at Children's Hospital on a variety of subjects in pediatric anesthesia, as well as morbidity and mortality, and at the monthly journal club at the citywide rounds for the entire University of Buffalo Department of Anesthesia. Depending on your interest, fellows may also participate in research and topical reviews that we will publish with a number of our staff. In terms of my background, I'm an academic anesthesiologist with almost 40 years experience in providing clinical care for neonates, infants, and children, and research in pediatric anesthesia. In the past 20 years, I've spent at the Children's Hospital here in Buffalo. That gives you some idea of the level of academics and evidence-based practice that we follow in our department. At Oshai, we provide a rich clinical and educational experience in pediatric and OB anesthesia for our trainees, and look forward to having you join us in our exciting program here in Buffalo. Take care, be safe, and thank you for your time.
Hi, I'm Justin McMaster, a PGY5 Peds Anesthesia Fellow here in Buffalo, New York. I'm originally from Nova Scotia, Canada. I've been living in Buffalo for the past 5 years or so for residency and fellowship now. It's been a great 5 years in this city. I've really come to love Buffalo. I really enjoy outdoor activities, and there's lots to do outside in the Buffalo area, with Lake Erie right nearby, and there's some canals that go through downtown Buffalo. As well, I got into mountain biking when I was here. There's a lot of really fun trails around the city. And I feel like I've got a great residency experience here. I learned a lot about anesthesia and now more about peds anesthesia during my fellowship. I feel ready to take on whatever comes afterwards.
Hi, I'm Dr. Thomas Johnson. I'm one of the anesthesia attendings at Buffalo General and the Gates Vascular Institute. One of the things I love most about this program is that I'm able to teach and work closely with the residents while still keeping up my anesthesia skills in the OR every day.
Hi, I'm Dr. Thomas Croucher.
I'm Benjamin Matson.
And we're both attendings at Roswell Park Comprehensive Cancer Center. Roswell Park has a little bit of an interesting history here. It was founded in 1898. It actually has the distinction of being the first cancer treatment and research center in the whole United States. It's a 133-bed facility here right in the heart of the Buffalo Niagara Medical Campus.
There's several of your core rotations that you'll do at this facility. One of them is the thoracic anesthesia rotation. You'll be in the thoracic room virtually every day of the rotation, unless you're doing another advanced case with a thoracic component. You'll have an opportunity to master your bronchoscopy skills as well as some of your other advanced procedure skills. And you'll become very facile with pulmonary physiology and one-lung ventilation and those advanced techniques.
And kind of along those lines, like Dr. Matson was saying, with the advanced GI surgeries, you do come back here as a resident as well for an advanced clinical rotation, which really does mostly become an advanced GI rotation. You'll do your Whipple procedures for pancreatic cancers, hepatectomies for liver cancers and metastatic disease, as well as esophagectomies for esophageal type cancers. So those types of cases, you really get a lot of experience with long, complex cases, a lot of critical decision making, and also to get to experience some regional and neuroaxial anesthesia experiences in those as well.
You will spend 2 modules at Roswell Park on the pain service, one as an intern and the other as an advanced resident. During that time, you'll round on patients that have epidural catheters or had intrathecal morphine. As well, you'll manage the postoperative pain for a wide variety of procedures. You will also see patients in the chronic cancer pain clinic, and you'll be exposed to a variety of chronic cancer pain treatment modalities, both medication-based and those that are procedural-based, including intrathecal pump therapies.
Dr. Matson here is one of our fellowship-trained pain attendings here, so you get very familiar with him on your pain rotation, right, Ben?
Oh yes, very familiar. You can't escape me.
One of the other clinics that we're highly visible in is our anesthesia perioperative evaluation center, or APEC clinic. So it is an anesthesiologist run clinic here at Roswell that handles all the pre-op assessments for our patients. So anywhere between 30 plus days to just 1 or 2 days before the surgery, where we do their intake as far as full history, physical exam, consenting, appropriate lab testing. So you get very good at, kind of meeting the patients on the front lines of deciding that it's time for them to have surgery and make sure that they're properly geared up before they go into the operating room.
A little bit about me. I'm from San Diego. I attended medical school at the University of Arkansas for medical sciences, and then came to Buffalo for my anesthesia training and as well as the pain fellowship. A large part of that decision was the facilities and the faculty that are here. In my spare time, I do what I can to enjoy everything that Western New York has to offer, both culturally and in the geography.
My backstory is slightly different. I've been here now 14 years, originally from New Jersey. I came up here for medical school at UB, and I've kind of worked my way through from the ground on up, as I like to tell the students as they come through. So I went through the 4 years here of medical school and then stayed for 4 years of residency. That decision was really based on going through the medical school experience here. I really enjoyed the format of how it worked here, and so I stayed for residency. And I was one of our chief residents, and then when I was getting ready to graduate, I was offered the position here at Roswell, and I took it, and I just celebrated my 6-year anniversary here. And the way that I tell the students when they come through is that there was just something about Roswell that always just had that spark of life in me. Just something about the patients and the family members, and you're meeting these people at one of the lowest points of their life, and coming in for these big surgeries sometimes, and just being that person who can help see them through it, maybe put a smile on their face, help them take their mind off of their troubles for a little bit, is just really what made it all worth it for me.
Thank you for your interest in our program. We appreciate your application. I hope that you have gained a little bit more information and insight into the sites that are here. I know that you'll find the training here is second to none. Thank you.
And good luck.
Hi everyone, so welcome to Buffalo. My name is Vanya Korek. I'm a PGY5 Anesthesia Pediatric Fellow here in Buffalo. I'm going to tell you so many reasons why you guys should come here. First reason, we have an ocean view right behind me, but all jokes aside, we do have a lot of wonderful things happening in Buffalo. We have a lot of lakes. If you're into a lot of water activities, we do a lot of hiking. During winter, we obviously do a lot of skiing and skating. So there's a lot of activities happening. In addition to all of that, our residency program is absolutely great. We rotate through 5 to 6 different hospitals. We're a university program, which means there's a lot of support for us when it comes to research. In addition, we do offer 3 fellowships. We have the Pediatric Fellowship, Cardiothoracic Fellowship, and also the pain, which is a huge advantage. So consider all those things when you're picking Buffalo.
Hi guys, Dr. Naaman Fennick here, one of the CA3 residents currently rotating at Erie County Medical Center. One of my favorite things about this program here in Buffalo is you will be ready to take on any challenge that comes through the door. Rotating at different clinical sites that each have something special to teach us has definitely made the experience well worthwhile. I'm going to show you one of the operating rooms where we take care of level 1 traumas, things like gunshots, stabbings, really bad slips and falls, and anything else you can imagine.
Hello, I'm Dr. Edmund Yansevich. I'm an anesthesiologist here at the Erie County Medical Center.
My name is Sean Michael Canty. I'm the Chief of Service for Anesthesiology here at Erie County Medical Center. I've been here over 5 years now. I'm a native Buffalonian. I was brought back to the area with the birth of my first son, and I came to ECMC for the level 1 trauma care that we provide here. We spend every day taking care of the most critically ill, critically injured patients from all around the community and the surrounding area. We are the only level 1 adult trauma center in Western New York. We care for patients from over 8 counties in the surrounding region, and we have a lot to offer in our department.
Erie County Medical Center is just that. It is a medical center. In addition to the trauma that we serve, we have basic medical care. We have a regional burn center, behavioral health. We have a long-term care facility called Terrace View. All these patients, all these pathologies, pathophysiologies contribute to your and even my learning experience as we continue to learn and grow as physicians.
So Ed, you trained here. What were the most important parts? What did ECMC add to your education as a physician anesthesiologist?
I think first and foremost, it's a sense of pride. The work truly is life-saving. We do make a difference. There is a wide variety of cases we do. The staff, anesthesia, as well as the surgeons and internists work truly as a collaborative team in providing the best care we can.
So I didn't train here. I trained elsewhere at the University of Miami, Jackson Memorial Medical Center, and specifically Ryder Trauma Center, which is where I focus most of my training. And when I decided to come home, I knew that if I were to come home back to Buffalo, that ECMC was going to be my home due to the trauma services that were offered. I'm proud of our efforts on a daily basis to care for all the traumatically injured patients and the non-traumatically injured patients. We do a plethora of perioperative care around here. We offer several orthopedic services. We have plastic and reconstructive services, general surgery. So your education here is really well-rounded when it comes to the depth of experience that you're going to have when it comes to specifically anesthesia training. The best things I think we have to offer are, number one, the trauma experience, perioperative care of the trauma patient. Number two, I think difficult airway. Okay, we have several difficult reasons for having a difficult airway, everything from allergic reactions, medical issues, to traumatically injured airways, to pathology from cancer care, which you get to treat and explore how to manage both in a planned setting and an emergency setting.
The traumas that we do here are often horrific, but you're part of a team. You're never left alone. You're in there, you're learning about massive transfusion protocols. You're learning how to manage pressors in an acute environment, how to balance perfusion with, not disrupting coagulation pathway. At the end of the day, on any call night, you're gonna leave this place knowing that you've done something. You've done something incredible, something special. And that goes a long way. Certainly re-inspires me every day when I leave at 7 o'clock in the morning after a long night call to come back the next day and make a difference.
Yeah, I agree. I think also what ECMC has to offer in terms of your education would be everything from the first day of your internship to the last day before you graduate and walk out in the world as an attending anesthesiologist, right? You get experience in our emergency department, our brand new, beautiful 60-bed emergency department. You get experience as well in our trauma ICU, where it's an 18-bed facility, which cares for the most critically injured patients in and around Western New York. And as you transition throughout your anesthesia education, we can start you in the beginning, then we work towards transition to practice, right? We have a 4-bed ambulatory surgery center, or 4 operating room, ambulatory surgery center, where we focus on throughput, outpatient procedures, efficiency, to really get you ready to get out in the community, wherever that community may be, to really transition to practice. So we prepare you here from day one to the last day to get you ready to get out and take care of the people that need your help in the community.
It is a remarkable program overall throughout the University of Buffalo. So many times I've seen CA1 come through, and could tell that they're brand new at this. Muscle memory is not there, but we have the opportunity to shepherd them, to show them best practices, and it is truly a privilege to do so, because we are essentially building the next generation of anesthesiologists.
I think another unique opportunity you have here at ECMC during your training is the opportunity to participate from the very beginning in transplant surgery. We have a kidney and pancreas transplant center here, which we have high volume of procedures. You're exposed right from the beginning as a resident, and you get to care for these patients on what we often call their second birthday. It's the beginning of a new life, and to be able to be afforded the opportunity to participate in their care during those experiences is something that has stuck with me since residency, and I see our residents very excited to be a part of.
Another beautiful part of the process is that when you come back to us the next year and the next year, the growth that we see is astonishing. We are so proud to have you graduate from our program, and whether you're going to stay in our community or whether you're going to go to the other side of the country, we are confident you'll be able to handle any situation you're put in.
Hi there, I'm Dr. Koch from the ECMC hospital. The thing I like most about our residency program is actually the variety of hospitals that we rotate through. My hospital specifically, ECMC, we're a level 1 trauma center. You do see a lot of interesting, very action-packed cases where beat-to-beat decision-making is very much a requirement. You have to think fast, think on your feet. The other thing that we do at ECMC are transplants. We do quite a few kidney transplants. We've also moved into the area of pancreatic transplants, as well many orthopedic procedures, ENT procedures that are done at our site. And that's all there for you to experience when you rotate through our hospital.
Hi, my name is Luda Sewell, and I'm a PGY2 and a first-year anesthesia resident here at University of Buffalo. University of Buffalo is my first choice residency program. Being from Toronto, Canada, this feels like an extension of home for me. One of the reasons why I chose this program was the program director that I met during the interview, Stacy Watt, and some of the other attendings. They all seemed very invested in the development of their residents and making us the best anesthesiologists that we can be.
I'm Dr. Benjamin Matson, anesthesiologist and cancer pain specialist at the Roswell Park Comprehensive Cancer Center here in Buffalo. I'm also the Associate Program Director for the UB Anesthesiology Residency Program. I hope that you enjoyed our tour virtually of our facilities and our faculty, and I hope you enjoyed getting to know us better. I hope that you will come and join us as a resident and see the exciting things that we are doing here in Buffalo now and in the future. Thank you for your time.
I'd like to echo what Dr. Matson has said. Thank you for spending time with us and getting to know more about the University of Buffalo. If you have any questions about our program, please feel free to contact us. The link will follow shortly after the end of this program. Thank you again. Have a good day.